Hi, my name is Dr. Naomi Simon. I'm a physician here at Mooresville Dermatology Center, and I'd like to talk to you more about skin cancer because May is Skin Cancer Awareness Month, so we just like to do a couple quick reminders on skin cancer, who can get skin cancer, what skin cancer might look like, and when to call your dermatology office. So skin cancer comes in three main forms. Basal cell is the most common type, then squamous cell, and then melanoma. People who are most at risk for skin cancer are people who tend to be more fair-skinned. The lighter your hair and eye color, the higher your risk. If you're a person who inherited the mole gene or the propensity to make moles, having more than 50 moles on your skin can mean you have a slightly higher risk of skin cancer. And then if you have a childhood history of a lot of sun exposure, some of us, we were kids running around with a lot of sunburns before they really had much in the way of good sunscreen. Some of us used baby oil and iodine to tan up our skin way back in the day. So if you had a lot of sun exposure and sunburns as a young person, that also increases your lifetime risk of skin cancer. So the good news is skin cancer is visible and you can catch it early if you're looking. So what are the signs of skin cancer? Basal cell carcinoma is oftentimes a small pink or red bump on the skin. Sometimes it can look like a little flaky patch. Sometimes it can look almost like a pimple. People describe it as a sore that won't heal, a spot that just never seems to go away. It's always red. It never really seems to get smaller or resolve. And usually over time it will grow larger. Sometimes basal cell can bleed. Sometimes it can feel tender to the touch. If anything like that appears on your skin, if it hasn't resolved itself, a pink spot, in over about 4 weeks, you should probably give your dermatology office a call and tell them you have a changing spot that needs to be checked out. Now the next type of skin cancer, squamous cell skin cancer, kind of similar to basal cell. They both tend to be in the pink or red category. Squamous cell tends to be a little bit more scaly or flaky or rough feeling, and definitely sometimes will hurt, or people will describe it like, I feel like a little pin prick or a needle poking me in the skin. If you feel something like that growing on your skin, and it can actually grow pretty quickly, also another reason to give your dermatology office a call. Finally, melanoma. Now, sometimes melanoma comes from a mole that you've had for a long time. And so it's a really good idea if you check your skin periodically, like every couple of months, do a birthday suit check in the mirror. And, don't forget to look at places like the bottoms of your feet, your armpits, have somebody help you check your back and your scalp. Because a mole that you've had for a long time that suddenly starts to change, whether it's getting larger, the border's changing, it may be becoming asymmetrical. You used to be able to have see a nice symmetry line down the middle, and now one side's growing different. Different colors within the same mole, or the diameter is growing larger. Or over time, it just looks more and more different than it used to look, or evolving over time. That's what we call the Abcdes of melanoma. And if a mole is doing that, again, call your dermatology office right away to get in. But a lot of melanomas actually come up as a brand new spot on someone's skin where there wasn't a mole before. So as a rule of thumb, as you're getting older in your 30s and 40s, if you develop a brand new mole that just pops up out of the blue, especially if it's what we call an ugly duckling, it doesn't look like any of your other moles, it's growing faster, it's a different color, or it just feels funny, it may itch or feel tender, another reason, call right away. You need to get in and have that checked out. We also see kids here. We do a lot of mole checks in kids with a family history of melanoma, or kids who just have a lot of moles, young people, teenagers. We have actually removed abnormal or precancerous moles from teenagers. So, make sure your kids and your young people are doing all they can now to protect themselves from the sun, whether that's wearing a hat when they're playing sports, getting sunscreen on the ears and the back of the neck, reapplying 1 or 2 hours after being out in direct sunlight, and wearing UV protective clothing. That's my favorite thing, actually. If your kids are swimming or at the beach, they should be wearing a swim shirt, some kind of board shorts, a hat, all of that to protect them from getting excessive amounts of sun as a young person, and especially preventing the sunburn. Well, thanks for listening to our talk about skin cancer, tips on how to find skin cancer on your skin, and how to protect yourself from skin cancer. We would love to have you as a patient here at Mooresville Dermatology Center, so if you have any skincare needs or find a suspicious spot on your skin, give us a call. Thanks and have a great day.